When I became a prescriber of medical abortion, I thought it would be really hard. I anticipated grappling with ethical dilemmas and what I believed was a complex and dangerous area of medicine. But it turns out that that was only because of the stigma surrounding abortion. The medical risk from carrying a pregnancy to term is greater than the risk of abortion from a trained health professional. My experience as an abortion provider was one of joy and empowerment. I believed fiercely in my patients' rights to make decisions about their own bodies, and I was proud to educate and support them to exercise that choice as safely as possible, whether that was prescribing medical abortion, organising surgical abortion with a colleague, providing non-directive counselling or organising mental health support, or providing antenatal care for a pregnancy a patient decided to continue. Dr. Anna Noonan of the University of Sydney and based in Orange recently published excellent peer-reviewed research in the journal Rural and Remote Health, finding that a small but influential number of medical practitioners are not just refusing to provide abortion services but obstructing access, leaving people unable to access terminations in many parts of the state. This was not the intention of the conscientious objection provisions in the Abortion Law Reform Act 2019. In recent weeks, the media has reported heartbreaking stories of people being turned away from regional hospitals when they need essential healthcare. The Health Minister has done the right thing by stepping in to ensure that clinicians at Orange Hospital are not restricted from providing abortion. I need to point out that the public largely expects that abortion services are available in public hospitals, and communities have been shocked and horrified to learn that many don't. Orange and Queanbeyan are not the only places with this problem. There is nothing in the current legislative or regulatory framework stopping this from happening over and over again. Local health districts currently have to provide a pathway for abortion services, but they don't have to actually provide abortion services. Too many of these pathways involve a private provider or an unreasonable distance for people to travel. The government has invested in the SEARCH program and the Pregnancy Choices Hotline. This is an anecdote from a health worker who told me that they called that healthline seeking advice on where to refer someone that was past the gestational limit for their private clinic. They waited on hold for an hour to then be told that they couldn't actually tell them which hospitals provide services and that patient needed to go back to their GP who would have to advocate for access at their local hospital based on the availability of particular doctors and rostering for surgical theatre lists. That's not a system. This is not the level of care that communities across New South Wales expect. A representative survey commissioned by Australian Clinicians for Choice in early 2023 found 68% of New South Wales residents believe every public hospital delivering women's health services should also provide abortions. There was majority support for greater access to abortion services among voters for both Labor and for the Coalition. I applaud the Health Minister for making it clear that abortion rights will not be wound back under this government. But continuing business as usual is not enough. I thank the Premier for his commitment last week in the Legislative Assembly that abortion services will be fully funded and services will be available in public hospitals. Given the state of the public health system at the moment and the level of distress and burnout among health workers, I understand that there are some workers who are distressed by the idea of having to provide additional services on top of their already really stretched workloads. I really empathise with that sentiment. That's why these services absolutely have to be resourced, and those workers have to be adequately paid to provide those services, I'll note as well. But there are nurses, midwives, obstetricians, gynecologists and GPs across the state who are ready, skilled, willing and able to provide these services in public hospitals. They need to have a framework, both in terms of regulation and funding, that just allows them to provide this care in the regions. When we've got good healthcare workers in the regions, they need to be supported to actually provide that care. Access to reproductive rights is under attack from South Australia and Queensland to what we're seeing in the US. I'm proud to represent the Greens who are always pro-choice. Every MP, every vote, every time. I'm drafting a private member's bill that would update the Abortion Law Reform Act here in New South Wales. I invite the government to work with the Greens and many other ongoing advocates to progress this important reform, and I call on the government to fund abortion in public hospitals.